All right. So our speakers are Rebecca from Inpatient Coordinator, Tracy Bodford from Inpatient Social Work, and Lauren Franson, who's also from Inpatient Social Work. I am going to jump off, and you guys can see the presentation, right? Yes? Okay, so we're going to get going, and I think Rebecca's going to kick us off, and I'll be on later. And Rebecca, I think you're muted.
Okay. Hi, everyone. I'm Rebecca. I am one of the inpatient transplant coordinators. Basically, my role is for whenever you come in for your transplant, myself and two of my colleagues, there's three of us who work as the inpatient transplant coordinators, and basically we're here to get you set up for success for when you're discharged. So we do a lot of education with you on new medications, some other things you'll need to know for when you're discharged pertaining to post-op care, follow-up. We'll go over a lot about, infection prevention, just a lot of different things, because after transplant, it's kind of a big shift in lifestyle. Your medication regimen is totally flipped upside down. There's a lot of new stuff to learn. So basically, we're here to help you navigate that, so you feel prepared, you feel comfortable and empowered when you go home to, be in charge of your care. We order medications so that you have everything in hand when you're discharged. You're not running around to different pharmacies trying to track down all these new medication bottles, because like I said, it's a lot to learn. So we get everything delivered to you for before you're discharged. And we are also involved in getting you set up with your post-op follow-up appointments. So your clinic visits, your lab work, visits with the doctors, all that good stuff. So that's a little bit about my role, and I can hand it over to social work. They can explain a little bit about what they do.
Hi, my name is Tracy. I'm one of the inpatient social workers. Our job, mine and Lauren's position, is to help you with coping while you're in the hospital, making sure you have registered for your pharmacy, helping set up lodging, assisting with FMLA paperwork, those sorts of things. And we'll get into that further as we go through the presentation. Okay, I think we can go next, Pat. Okay. All right, Rebecca, do you want to start or do you want me to start?
Yeah, no, I can talk about this.
Okay.
So, the nature of waiting for a transplant, it's very unpredictable, especially when you're waiting for a kidney transplant. Some people wait a long time. A lot of people don't wait a long time. It's, really just depends on person to person. So what we advise is that you're always prepared to get that phone call. So if they give you an average time of this many years, it doesn't mean that you're not going to get called in sooner. You could get a call anytime, middle of the night, when you're at dialysis, anytime you can get that phone call. So it's important that you kind of have a plan in place. Have your bag of things ready to go, which we'll go over a little bit more about what you need to bring with you. So Pat, if you want to flip to the next slide. So basically, the pre-transplant social workers, when you're kind of going through the initial workup and going through the listing process, they'll kind of provide you with a list of things that you need to bring with you. And this is especially important if you're from out of town. Make sure that you have your bag of things ready to go, and then anything else, like medications, you don't necessarily need to have in your suitcase at all times, but have a second list of the things that you don't want to forget to add to your bag at the last minute. So if you want to go next. I don't know, social work, if you want to.
Yeah, I'll take this. So always be prepared as far as expecting the phone to ring. Make sure that your primary and your backup caregivers are, aware that the phone can ring anytime. Of course, they will be when they're vetted with us. if your primary caregiver is going out of town, make sure that you contact the backup caregiver so that they can be at the ready in case you get the call. If you have any issues with your caregiver plan, sometimes the designate or the vetted primary caregiver will get sick or have to go away. There's all kinds of things that happen. Make sure you contact us in the social work department and on the outpatient side, Miss Pat, Lakaya, and Jeanette, and let them know that the caregiver plan has changed. Be sure to let us know that. All right, next. Rebecca, you can talk about this one.
Yeah. So part of being prepared for transplant is registering with a specialty pharmacy. So these pharmacies are different from, your Publix or CVS down the street. These are mail order pharmacies that specialize in transplant medications, and we ask that you register with one of these specialty pharmacies so that we can get all of your medications delivered here so that you have them set to go for when you are discharged from the hospital. Like I said, we order the medications so that you don't have to be running to pharmacies all over town trying to get all of your meds picked up. But we do ask that you sign up for a specialty pharmacy for this purpose so that we can get everything ordered and mailed here. And then you can continue to use them for future fills when you're discharged from the hospital. So social work will give you a list of a few of the common pharmacies that patients will register with ahead of time. So you can inquire with those pharmacies, but you can also check with your insurance company on if they have a preferred specialty pharmacy, because certain insurance companies will want you to use certain specialty pharmacies. So if that's the case, you need to know that ahead of time and register with the specialty pharmacy that you're going to go with. Registration with specialty pharmacies can take a few days to get set up depending on the pharmacy, and it can kind of delay things in terms of getting your medications. Because if you come in and you have not registered with a specialty pharmacy, and then we're getting you set up with one, it can take a few days for them to process you as a new patient, get your profile set up with them, and then we have to go through ordering the medications, setting up delivery, and all of that. So it can really delay things. And sometimes after kidney transplant, you only stay for a few days. So it can cause problems in getting the medications delivered in time for you to be discharged. So that's a really, really important step that you can take now that will make things a lot smoother after your surgery, so that you're already set up with a pharmacy. We order the meds, get delivery set up, and you'll be set to go. So that would be a really helpful thing, not only for us, but for you as well, to go ahead and make sure that you're getting set up.
Mhm.
So another thing, kind of on the same page as medications, is bringing your medications with you to town. Now, if you're a local patient, this is not as important. You don't need to bring all of your medications to the hospital with you, but just kind of have a list of what medications that you do have. But definitely, if you're from out of town, bring those medications to Jacksonville with you. Even if you just leave them in the hotel, that's okay. But the reason that we recommend you do this is because after transplant, some of your old medications might continue, like blood pressure medicines, for instance, some other things we might have you keep taking after you're discharged from the hospital. And it's good if you've already got those medications, because we order what's new for you, and then you can continue taking what you were on before as instructed. So you don't take those meds while you're in the hospital. The nurses will give you medications from hospital supply. So this is really just, again, something you can do to make things go smoother after you're discharged. And another thing to note is, if you don't bring your medications and we try to order it for you, Sometimes it's too soon for insurance to fill those medications, so you would have to pay out of pocket for that month's supply. So it's a good idea for you to just have all of your medications. Don't bring the organizer, bring all of the bottles, because remember, you're going to be lodging for a month, so you're going to need a full month's supply of your medications.
And one thing I'd like to bring up here really quick is one thing I've noticed in the hospital recently is caregivers, depending on what time you get the call to come in, the caregiver don't have their, like, for instance, blood pressure medicine. So they've ended up staying the night in the hospital with the patient, and then all of a sudden they don't have their medication. And so they're tired and just not feeling well. So if you get called in the middle of the night, have a day or two of your own medications with you until you can get to lodging, just depending on what time you get called in.
So, something else that we want you to keep in mind is if you have any other medical equipment, so supplies for checking your blood sugar, if you wear an insulin pump, CPAP machine, home oxygen, blood pressure cuff, scale, thermometer, if you have a walker that you use, any
Yeah.
of your medical equipment, bring it with you to town, because there's a good chance you're going to need these things after you're discharged. So the blood pressure cuff, scale, and thermometer you will definitely need, because we're going to have you monitoring your vital signs after you're discharged from the hospital and logging them in a binder. So we definitely want you to bring those supplies with you. The insulin pump you may or may not use. Sometimes they'll put you on the insulin pens temporarily, but it's a good idea to have the pump with you, because they'll want to see what your settings are so that they can kind of come up with a plan for managing your diabetes going forward. And a blood sugar meter, if you were checking your sugars before transplant, definitely you're going to be checking it after transplant as well. So it's important to have all of these things, pack them and bring them with you when you come to town.
I'll speak about this, Rebecca. So think about, before their phone rings with the Oregon, think about where you're going to stay. Have a plan. Maybe the Gabriel House. I know the social work team will send you a lodging list. We also provide those in the hospital when you come in for the surgery, but just have something in mind, at least 3 or 4 options so that you're prepared when you get here. And we can help you with that if need be when you come to the hospital. But it's always good to have some homework done ahead of time. Make sure that childcare is arranged. At any given time, the phone can ring. Holidays, doesn't matter. Just make sure childcare is arranged. Make sure you have arrangements for your pets, pet sitter, taking them for boarding, and make sure elder care is arranged if need be.
I
You want to
can
talk about?
go
I'm
there.
Go ahead.
Yeah. So basically, you're going to get the call from procurement. They're going to let you know that there's possible kidney for you. They'll kind of go over the process, and basically, you're going to come in through ER registration. And it's important that your caregiver needs to know right away that you're going in for a transplant. So if they're not in the same household as you, if it's a friend, you need to call them right away. And we want them to come with you or be not far behind you, because there's going to be a lot to go over, and it's important that they're there with you. Registration will go over your insurance information, make sure that there are no issues with your insurance coverage. But if you do know of any changes to your insurance, you need to let registration and social work know right away. So if it's something like you have a new plan and you just don't have a card yet, or anything like that. Make sure that you let them know right away. And when you come into the hospital, it's honestly kind of overwhelming because you're going to have a million people trying to see you all at once. There's practically a line of people out the door because so many people need to see you and talk to you. So, the surgeon needs to see you, social work, case management. You're going to have a nurse that's prepping you for surgery. Um, Transplant dietitian. There's going to be pharmacists reviewing your charts, the kidney transplant doctor, nurse practitioner, a million people. You're going to be very popular. You're going to have a lot of labs that need to get done, x-rays, EKGs, a lot of like last minute checkups. It's like the ultimate checkup, really. So just know that when you do come in, it is a little bit of a, oh my gosh, a little bit overwhelming. And you're nervous because you might be getting a surgery, and all these people are coming in here. So that's just kind of an idea of kind of what to expect.
As far as social work, either Lauren or myself, sometimes our part-time partner, Patricia, one of us will meet with you to go over your caregiver plan in detail, make sure we have the correct phone numbers. This is why we'd love to have we would love it if your caregiver was with you during their initial visit. We do encourage the caregiver to go back to lodging in the evening to rest, but we do expect the caregiver to be in the hospital like 8 a.m., 3 p.m. every day for teaching. It's good for observation of the nurses on the medications, learning how to write in the binder with the medications, and you'll learn about that more when you get here and get the notebook. So we go over all of that. Confirming pharmacy choice, confirming lodging or assisting with lodging, asking about financial status or any financial worry or concern, go over your insurance. Again, this is another place where you would say, okay, my insurance has changed. So we can make sure we have that information in your medical record. And we also assist with FMLA or critical illness paperwork. You'll give us those forms, we will deliver to the appropriate team, and we will assist you with getting those filled out and faxed for you to your work. And we also will visit you a lot in the hospital, 2 or 3 days a week. And our big focus is coping, especially if you're here more than 3 days. Sometimes it's longer and it can be really challenging. So, our job is to, be your shoulder if you need one, so please reach out to us when you're here if you're having a hard time. It's a very difficult thing. It's, sometimes that's why we're here. As far as caregiver support, myself and Lauren and Patricia, we're here to provide emotional support for you while you're in the hospital. Again, let us know if you're having trouble. This is not easy. The caregiver support group is exclusively for caregivers, and they meet on Thursdays at 11 via Zoom. It's a very helpful group. It's really good, especially for heart and lung patients, because they're here for a long time and the caregiver can really get burned out. So it's just a place for just caregivers to go and support each other. And you can let us know if you're interested in that, and we can make the referral to Eric for you. Okay, go ahead, Rebecca.
Right. So basically, I went over a little bit earlier about what the inpatient transplant coordinators do. So, you have a pre-transplant coordinator when you're going through the evaluation process. And then when you come into the hospital, you've had your transplant, you'll meet us after you have your transplant, very soon after, because we start teaching right from the get-go. So, literally, the day after surgery, we'll be in your room introducing ourselves, setting up a time to do your transplant teaching. Because, like I said, sometimes after kidney transplant, you're only here for a few days. It's a lot of information to cram in, really for any organ transplant. So if we wait until the day you're discharged to throw all this information at you, it's going to be total information overload. So we start it early, so that you kind of are already familiarized with what's going on. What are these medications? Why am I taking these meds? Um, Different things like that. So we do the teaching, do a lot about the new medications, your follow up, post op care. And we do ask, like Tracy was saying, that your caregiver is in the hospital during the daytime hours. Um, for the teaching that we do, but also teaching with the bedside nurses when they do morning medications. So social work can check in with you if there you have any needs. You'll get teaching from a dietitian. You'll get a visit from the infectious diseases doctors, to go over infection prevention, things like that. So it's a lot to kind of cram in. So it's important that you're there, and also just kind of learning things about the post op care. Um, you know, Helping the patient walk in the hallways, because that might be something that they still need a little bit of assistance with when they leave the hospital. So, just kind of being comfortable and familiar with the overall plan of care. It's really helpful if you're there during the daytime hours. That's when a lot of the teaching happens, and it's kind of when all the action is, right? So, we definitely recommend that you be as available as possible. So, and I can talk a little bit about this as well. We have transplant pharmacists who do daily chart checks on all of our transplant recipients. So every single day, they're reviewing all of your medications. They go to, it's called rounds with the doctors when they meet as a team, discuss all of the patients, what's going on, and they will kind of chime in on if there are any medication interactions, any precautions on certain medications, any special considerations, for the medications that you are on. So they're a really great resource that we lean on a lot here in the hospital. And then you'll also have a dietitian who comes and sees you and it does an assessment, and they'll follow your progress throughout the hospital as well, making sure that your appetite is sufficient, that's coming back adequately after transplant, so that you're getting enough calories, that you're not having any nutrient deficiencies, things like that. So, those are just some additional members to the transplant team, that you'll definitely come across during transplant, and then after your stay when you're in post op. So, for the discharge instructions, so this is, you've had your transplant, you've been here for a few days, and you finally reached your discharge day. It's time to go back home or to your local lodging. So basically, the transplant coordinators, the inpatient transplant coordinators, so myself and my colleagues, we do your initial transplant teach, like I said, very soon after your surgery, but we will also do another teach on discharge day. Like I said, we're going to get all of the medications ordered for you. So you're going to leave with your first month in hand of everything that you're going to need. So we kind of go through all of the bottles with you. We review your updated medication instructions, kind of go over any remaining questions, concerns, anything that you need us to go over again. We're here to kind of take off the training wheels, set you free. Um, So we're there to kind of, do that final education session. But of course, we're going to give you the contact information. So after your discharge, you're never totally on your own. You have 24-hour access to the transplant team. So if you ever have questions, concerns, you can always call. So I don't mean to scare you by saying that we're setting you free. Um, but basically, on discharge day, like I said, we're making sure that you feel totally comfortable going home and managing your medications, managing all the post-op care and everything. So, and maybe social work can elaborate a little bit more on this, but make sure that you have all of your lodging set up. And if there are any issues with lodging that come up last minute, or you thought you were going to have your room reserved, but now you found out there's not, let someone know as soon as possible. Don't wait until the last minute, so that we can, help you with that if possible.
Yeah, just to piggyback that, like she said, like Rebecca said, don't wait till the last minute to find lodging. We have a lot of, football games, festivals, things that go on here different times of the year. So just do not wait till the last minute. The day that you come into the hospital, when the surgery's official, because sometimes you can have a dry run up until the last minute, literally when you're in the OR. Just make sure that you've got lodging planned. You just don't want to be caught trying to call around at the last minute when you're on your way out the door of the hospital and you don't have lodging.
So, after you are discharged from the hospital, um, we like to kind of let you know ahead of time that there are going to be a lot of follow up appointments. So we tell you this now so that you kind of are aware and your caregiver knows it's not just a one and done, yay, I have my transplant or I have a checkup in a couple weeks. It's not like that at all. There's going to be very frequent follow up multiple times a week, every week for several weeks after transplant. So you get your finalized schedule on discharge day that's going to have all of your appointments listed for you. And if you are from out of town, they'll let you know after that point if you're good to go back home, or if you have any further follow up and what that's going to look like. But basically, be prepared to be at the hospital often for appointments, lab work, doctor's visits, visits with your nurse coordinator, visits with the dietitian, diabetes educator. Um, Sometimes there's follow up scans. There's a lot of different things going on, and they can't always be scheduled back to back. So sometimes you're going to have some long days where you have some gap between appointments. Sometimes you are discharged from the hospital and you come back the next day for appointments. So we encourage you to kind of be aware of that ahead of time and prepare to have flexibility, because there is a lot of required follow up, and it's really, really important that you're compliant with this follow up, because that's what's going to give you the best outcomes.
You will have, just to piggyback that really quick, you will have usually really early morning labs, like 6:37 in the morning. You are allowed to stay within 1 hour of Mayo for a kidney transplant, but I really wouldn't advise it if you're not a morning person. I would recommend that you stay closer, just because of those labs. And you're here, pretty much all day. With back-to-back appointments, it's very busy, at least for the first week or so after your discharge from the hospital.
So, also worth mentioning that after transplant, you cannot drive until the transplant team clears you to do so. A lot of times you're going to be on pain medication for at least a few days after you're discharged from the hospital. And then you're going to have some restrictions pertaining to your surgical side. If you've got an incision across your belly, and it's not fully healed, it's really not safe for you to be maneuvering a car. So keep in mind that you as the patient will not be driving for at least the first month until the transplant team clears you to do so. So until then, you're really going to need your caregiver to be available for all of the driving to appointments and anywhere else that you need to go. Caregivers are also expected to be at all of your follow-up appointments for the first month after transplant. So visits with the doctor, with your nurse coordinator. They need to be not only transporting you, but coming to that appointment as well. So they can't just drop you at the door and say, call me when it's done. They need to be in that room with you, involved in your care. It's really important because, even if you were managing everything on your own before transplant, after transplant, it's a whole different animal. There's a lot more involved. The medications are a lot more complex. So it's important to have them to help speak up for you if there's something that you forget to mention to the doctors, or also as a second set of ears, because you're going to be getting a lot of new information. It's not just when you're in the hospital, even after you leave the hospital, there's going to be changes to your medications, more stuff going on. So it's important to have that caregiver support with you to help kind of facilitate everything. And, if you have problems with caregiver support, you're more likely to have unfavorable outcomes with your transplant. So, good caregiver support is going to set you up for success for sure.
This is my kitty cats. This is Bart on the left, who wants to know if you have a question. And on the right is Gracie, and I think she does have a question because she has her hand raised. These are my babies. I adopted Bart on the left from the Nassau County Humane Society in February, and Gracie was basically a stray kitty that I adopted 2 years ago. And when we moved into our house, she came with us, of course, and she's turned into a big baby.
So do you guys have any questions? You can unmute and ask questions, or you can throw it in the chat, or raise your hand, whatever you want to do.
I have a question.
Okay.
Can you hear me?
Yeah, barely, but yeah.
Okay.
Yeah.
I live in St. Augustine. When the follow-up lab test that you have to do post-surgery, can I do any of that lab work in the St. Augustine clinic?
I can do it.
Can you guys answer that? Oh, go ahead.
Yes.
Okay.
Tracy, do you have an answer?
No, I think so. Yeah. I believe that can be arranged.
Okay.
Yeah, they can do that. Yeah, they can do that. Rebecca, do you guys arrange that, or is that something the outpatient coordinators are doing?
So I would have to find out. We are the ones that get you set up for all of your follow-up lab work and everything. So I'll have to check with my office on that, but I believe we can if we just let the schedulers know that you're going to be going to that location for your labs. I'll find out for sure, because I don't want to tell you one way or the other because I'm not completely sure.
Oh, so somebody put in the chat that they were told they cannot do the St. Augustine lab because they don't open until 8:30.
Perfect.
Okay.
It's too late.
Okay.
We'll
I
find
have
out
one more
about that for
question.
sure. Yeah.
Okay.
Yeah.
Go ahead. You had another question?
I do. Okay. So you say you're going to get this call and it's time to go to the hospital, right? What is the time frame? Like, I live in St. Augustine. If they call me at 3 p.m, do I have to be there at 5 o'clock? What is?
So when procurement calls you, they will let you know when you need to be in the hospital by. And some patients, if they're local, just depending on what's going on, some patients they have on standby at home, and then they'll call them and tell them when to come in. So it really depends on what's going on with the patient, what's going on with the the kidney offer. So some people will come in and they're going to the OR like right away, and other people will come in and it's several hours. So there's really no set time, but that's something that when you get the call from procurement, they'll give you kind of what the timeline is looking like for you.
Okay, so that call will
Are
have,
you?
you will be in the hospital within 24 hours, let's say, of that call at some point.
I was trying to get to this right here.
Okay. So
Yeah, go ahead.
I'm sorry. Can you guys keep muted until you've asked a question, or put your question in the chat and then we'll tell you to unmute. Okay. Sorry. Go ahead, Rebecca.
Yeah, no worries. Yeah, I would say generally it's within 24 hours you're going to be coming into the hospital. Usually, if they know of a possible transplant for you, it's not usually further out than that. Everyone is different, so I can't say that 100%, but usually it is, you need to be prepared definitely to be there soon, but they'll give you the timeline.
Okay, great.
Mhm.
Thank you.
And I will
There's
add,
another, I'm sorry, there's another question.
can I say something else, Pat, real quick?
Yes.
Sometimes the procurement will call you. I don't think it's very often, but sometimes procurement will call you and say, we're looking at a kidney for you. But if you want to, you can be on standby at home. We have that situation going on right now with a possible kidney offer. So just depending on where the kidney's coming from, how much they know about the kidney, they may allow you to wait at home. And then when they call you back, it's like, okay, you got to come in.
Okay, thank you.
Okay, so there's a question in the chat. Once we arrive at the hospital, about how long before the actual surgery begins and the average time of the surgery.
Yeah, so like I was saying, everyone's different. So sometimes you come in and like right away they're getting you prepped and you're going to surgery, and other times you're waiting for several hours. So everyone's different. But when you get that call from procurement, if they don't give you a timeline, just ask, when do I need to be there? And do you know of a timeline for transplant? With that said, definitely follow their timeline of when you need to be at the hospital. Because if they say, oh, you might go to surgery this evening, but we need you here at 11 a.m., you need to stick to that 11 a.m. show time. Because, like I said, there's a lot of people that need to come see you. They need to do blood work on you. They need to do x-rays. There's a lot of like last minute workup that needs to happen. So it's important that when you get that call, when they tell you you need to be at the hospital, that you're on time.
Okay, so Rob, I do see your hand up, but give us another minute. We'll do one more from the chat.
Yeah. Oh, and then sorry, the average time of
Yeah.
surgery, it's usually like at least a couple hours, maybe like 2-3 hours, but you also have to keep in mind that after the surgery, you go to the recovery room where the nurses are going to tend to you before you come back to your hospital room. So you can be in the recovery room for another hour, 2 hours, depending on what's going on. So it's definitely a several hours ordeal.
Okay, so the next question in the chat was, you said the caregivers must be in all appointments for 30 days. If I meet with a psychiatrist, am I allowed to do that without my caregiver? And yes, you are. You and your caregiver may each need their own psychiatrist. So not a bad thing to do those appointments alone. So
Yeah,
go
and
ahead.
it's
Yeah, go ahead.
mostly like the transplant appointments. So if you had like already had a checkup with like your dermatologist, your caregiver doesn't need to come with you. They need to drive you, but they need to be present with anything transplant related.
Okay, Rob, go ahead and ask your question.
Okay.
Yes. Is there a certain time in advance that you can schedule your lodging prior to your transplant?
Not really, because you don't know when the phone's gonna ring.
Right.
You can, that's why it's good to have a couple of hotels in mind at least. So that, you know, when the phone does ring, you can say, okay, let's call Town Place Suites or let's call Holiday Inn. And two, some folks will ask if they can arrange the Gabriel House ahead of time, but that's not true. You can't do that either. But you can call them when you get here and say, you know, my loved one is looking at a kidney transplant. I'm not sure about timing, you know, because again, it could still be a dry run, but just have some ideas. I have some ideas prepared before the phone rings.
Okay. Thank you.
So the next question out here is, you have a living donor. Is there a more flexibility with arrival time? And the living donors are scheduled. Those surgeries are scheduled.
Correct.
So you would know that in advance, and they would tell you what time to be here. And I think it's usually based on what the donor wants, right? That usually donor.
Hey, Pat, it's Christine. I can speak to
Yeah,
that.
thank you.
Oh,
Sure.
Christine.
Hey,
Hi.
so for living donors, yes, we do have specific times that the surgeries are scheduled for. So when you're getting the planning done with the living donor team, we'll go over that. Sometimes, you know, most of the time when it's a directed case, donors arrive at 5:30 in the morning, recipients arrive at 7 a.m. There are some other times where we do need to change those a little bit based on the OR scheduling, but that's our typical arrival times.
Okay, the next question is, can both caregivers be in the hospital at the same time while I'm in the hospital?
Caregivers can definitely be in the room during the day for teaching, but there's only one area for a caregiver to sleep in the evening if you, for some reason, you needed to sleep in the room. But caregivers are all encouraged to be in the room for teaching purposes, yes.
Okay, the next question is, I was told that we cannot use our own specialty pharmacy. We can only use the 3 on your list. For example, I have CVS mail order that would be free, but I have to use the pharmacy on the list that you provide, which is out of network. So I can tell you from the outpatient side how we do this. We tell you to try and register with one of those 3 pharmacies on the list. And that's because those can give us the delivery times that we want. And we tell you, if you've got a specialty pharmacy already that's with your plan, usually one of those 3 pharmacies can get an override. And yes, yes, you might have an issue. You might have to pay a little bit for that first fill, but after that first 1 or 2 fills, you can transfer your script to the other pharmacy that you want. Do you guys have, Rebecca, you guys have anything from your side on that?
No, that pretty much covers it. Basically, if there's a specialty pharmacy that you're registered with already, then great, but that doesn't mean you have to stick to that one. Basically, any specialty pharmacy that can take your insurance will be able to use for your medications. I will say, with full transparency, that there are some specialty pharmacies that we can get your medications sooner than others. So sometimes if there is like a timeline issue with using one pharmacy, we won't get your medications in time for discharge. We might say, hey, are you open to using one of our 3 that we provide? So I will kind of say that. But generally, if a specialty pharmacy can take your insurance, then you should be good.
If anybody is unmuted, can you please mute yourself, because we're getting some background noise.
And I'll also add really quick, if there's an unusual pharmacy that you want to use, you need to let myself and Lauren or Lauren know that right away when we come to your initial social work consult in the hospital, so that we can go let the transplant coordinators know so they can start working on your medicine. Again, it's like a 3-day turnaround usually for kidney transplants in the hospital. So we need to get started on getting your medicines ordered as soon as possible.
Okay, the next question out here is, my caregivers are in Atlanta and Los Angeles. Is that a big issue? And I don't think it's a big
Well-
issue as long as they're on a plane within 2 hours of you getting to the hospital. But they
And
need to be on a plane or during the car, right?
and they need to be available for the 28 days. So, can't be like, I'm in Los Angeles and I can be here for the weekend, then I'm going back home. Are you good? No, you need to have a caregiver with you for the full 28-day period after transplant.
And
And-
they don't necessarily have to be here before your transplant. We like them here, but they definitely need to be here once you're out of the OR.
Because sometimes it will be a dry run, so it would kind of stink to be on a plane from LA and then the transplant gets canceled. So it's okay if you want to wait until they're in the OR having surgery and definitely getting the transplant. But it's like Tracy was saying, it's important that they're here after for sure.
Okay, the next question is, if you were a current caregiver from a heart transplant last year, do you have to do the caregiver training again? No, you don't have to do it again. Just send us back the caregiver plan showing that you've done it before. Okay, that's the requirement for kidney. And then the next question is, we are 4 hours from Jacksonville, so they are aware of that and work with that at the time, I am assuming. And can you explain a dry run?
Yeah, so procurement knows, all the patients that are waiting that are potentials to receive transplants. They know kind of like your geographic location, so they know if there's a transplant that has to go into the OR in the next hour or the kidney is no good, like they won't call someone that's several hours away, so they know where you're coming from. And if they call you and say, hey, can you be here in this X amount of time, you say, I'm coming from 4 hours away. Just make sure they know, but generally they already factor that in. So and then a dry run is basically when you come in for a transplant and it gets canceled. So it can get canceled at any time along the way. It can get canceled when you're driving to the hospital. It can get canceled when they're about to put you under anesthesia. It can get canceled anywhere in that timeline for any number of reasons. It could be something going on with you, the patient. They might detect something like in your blood work, or it could have something to do with the actual kidney itself that's going to be transplanted. If the surgeon sees something abnormal on it or something that's makes it not a good fit for you or just not suitable for transplant in general. It could be because it turns out the organ is not compatible with you. So it could be any number of reasons at any time along the way. So it's kind of stinks when it happens. It's, a little emotional for some people because you get this big surge of emotions. You're excited, you're nervous, all of this stuff, and then it gets canceled. And it really can be a bummer. And for some people, it does happen multiple times before they finally do get the transplant. Some people don't have dry runs at all, but it is something we like you to be aware of, that just because you get the call, just because you're in the hospital, you're getting your IV put in, they're getting you all prepped, it's not a guarantee until that kidney is inside you.
Okay, there's another question out here. Do y'all know if B positive and B negative are compatible? And they didn't teach me that in social work school. Does anybody else know that?
That's something that procurement and the surgeons
Yeah.
work more with. I don't
I
don't
can
want to tell you
answer.
the wrong thing.
Yeah,
Yeah,
no.
go ahead.
You said B positive and B negative. Yeah, the
Yes.
positive and negative doesn't matter. So just it's the actual letter. So B is compatible with B. O is the universal donor. They can donate to anyone. Someone that is blood type A, they can receive an A or an O. Someone that is blood type B can receive a B or an O. Someone that is blood type AB can receive A, B, or O. And someone that is blood type O can only receive an O.
Awesome. Thank you.
So that's Christine Schneider, our living donor coordinator, one of our living donor coordinators who deals a lot more with that stuff than we do. Okay, any other questions? That kind of wrapped up the chat room. Do you guys feel like this is helpful to kind of prepare you a little more for what happens when you get here?
Yes, I did have a question.
Go
I'm
ahead,
sorry.
go
I
ahead.
did. My husband had a heart transplant last year, and I've been through the caregiver program at Mayo. Do I have to go through the whole program, caregiver program again?
No. I think
You
Pat
say no?
answered that. No, I think Pat answered that earlier. You just need to send us your form that you completed caregiver education, right, Pat?
Yeah, the caregiver plan form, just send it back to us.
Just send it back. Okay. All
Yeah.
right then.
Okay, there's another question out here. Is there a specific place to park? Because at times there's no place for parking. And I think when you come in, when you're called in, you're told to go to the ER. So there's a whole new parking garage over there at the ER. I think that's where they're recommending you park, right? Do you guys know?
I don't know for sure.
I'm not sure about parking either, honestly. But I know I can find out. We can find
Yeah.
out.
I would
Yeah.
try the new garage.
Yeah,
I've never had a
the
problem
parking
parking in the
garage is there, as well as sometimes depending on what time it is, you might get lucky finding a spot that's not in the paid garage.
Okay, there's a question out here. Is the caregiver allowed to go home at night and while the patient is still in the hospital?
Yeah, that's preferred. And if you live farther than an hour away, you're going to need to have lodging here. But we strongly encourage caregivers to be here during the day and then go home at night or back to lodging to rest.
Yeah, in the free side, we kind of tell you all the rooms at Mayo are private rooms with a pull-out sofa bed. So we tell the caregivers you can stay in the room, but if you cannot get sleep in the room, you need to be going home or to the hotel, right? Because you've got to be rested and you've got to be able to understand all the information you're being given.
And some of the new sofas that they put in rooms are not pull out and they're very uncomfortable. They're very uncomfortable. Some of them are still pull out, but you're not going to rest very well in the hospital. You need to go back to lodging or back to your house if you're within an hour at night.
Yeah, most people do not rest well in the hospital when they're a patient or a caregiver.
No.
It's just too much noise.
Mm-hmm.
If you are having living donor, will you be close to each other in the hospital?
So, not necessarily. Our goal is to always try to put our living donors on our transplant floor. However, the transplant floor does give priority to transplant recipients because they need that protective environment and the specialized care. So sometimes our donors do go to just a general med-surg floor, which is usually the 8th floor, but the donor would be allowed to travel down to the 3rd floor to see you. Usually on their way out the door. It's a long walk, so I always advise them, being wheeled past on their way out. If they're on the same floor, then y'all can walk the floors together and go in each other's rooms, but not always on the same.
So any other questions, any other concerns about what happens when you come in? Now you know some faces of who you're going to see on the inpatient side. Hopefully that helps a little bit.
Hey, Patricia, this is Gerald.
Hey.
Terry had called me, but I got $1,000 saved up for that rooming. So after I get Christmas for my kids,
Yeah.
I had the last $500. I just don't know what number y'all need me to fax that over to once I have it.
Do you have something to write down on, or do you want me to send you a portal message?
Well, you can send it in a portal message. That'll be better for me.
Okay, I will do that.
Thank you, Patricia.
Okay. All right. What other blood type is compatible with an A positive?
An A negative or an O? And it could be O positive or O negative. You're welcome.
Okay. All right. So just to let you know, I'm going to give you a little rundown on next month. So next month, we will not see you until after Christmas and after Hanukkah. So we want everybody to have a happy Thanksgiving and enjoy your holidays, relax and have some fun, but be ready at all times for your transplant. Next month, December 27th, I think, we're doing living with chronic illness and kind of how to live your best life while you go through all this stuff and while you're waiting and right after transplant. So I think that's a good way to kind of end the year, to wrap up the year, and to get you guys off on the right foot for the new year. So we have a very special speaker and some good information for you guys for how to start the year off or wrap the end of the year. Any other questions or anything?
No, thank you.
Thank you.
Okay. Well, and thank you, Rebecca, Tracy, and Lauren. We really appreciate you. And
Yes,
Christine.
thank you
for
so
coming in.
much.
Thank you.
Yeah. Everybody enjoy your Thanksgiving. Don't do anything we wouldn't do, but have some fun. Okay.
Okay, you guys too.
Okay. Thanks. Bye, everybody.
Bye, everyone.
Bye.